Very good evening, friends. Meeting with the session of Materia Medica. And since yesterday, we were discussing a very important psychosyphilitic defecting remedy, that is Conium Maculatum. In last lecture, we have learned one case of Conium Maculatum, Guillain-Barré syndrome, how I have treated that Guillain-Barré syndrome. And thereafter, the mental state of the Conium Maculatum, the constitution of Conium Maculatum, those aspects we have learned. It is a very important remedy because many pathologies it can cover. In fact, it is a very important remedy in cancerous cases where there is a very typical stony hardness, which is characteristically mentioned with this remedy, is there. So, we can. My suggestion is that those who used to join, please keep their mics off. Okay. So, before going to the further part of Allen's keynotes, I want to share one more case. It was a wonderful case in my practice again. It's a way back I have treated that. Yesterday I have mentioned about it that I will going to share that case. It was as if a CA of right breast. Absolutely, it is a gut ball like a ball, completely hard tumor, cancerous. It is and with ulceration, with little bit secondary bacterial infection, and the doctor said they refused the treatment. They refused basically the surgical line of treatment, and they said whatever you have to do is only chemo, but we don't know how much it will help. Patient, quite obese, female, around 45 to 45 years of age, good built. And when she came, she was absolutely in a morose state, depressed, because she was diagnosed, she was treated with chemotherapy, and there was recurrence, and that recurrence already 1 year before she was operated for that with breast conservation surgery, and there was recurrence, and after recurrence, this recurrence no one have treated properly, and it was a very huge problematic tumor over there, and she was absolutely depressed because doctor said that it is hopeless condition now. I will share the just a photograph. In this condition, patient was brought to me, and it was very dangerous to see. This was the picture. It was very painful, in fact, and very hard. It was absolutely hard picture. So, considering her all states, everything, she was morose, she was depressed. She had only one female child who was around younger age, marriage age, but still not married. And she is the lady who was learned but not doing any job. She was remaining in home. She was at the same time a confident lady, but at the same time she never wants to be never wants the company many times. Many times she wants to remain alone, but again there was a confusion. She used to fear remaining alone and quite disturbed. And whole story, she was weeping because she was told that it's the last stage of your disease. Nothing can be done. So, considering the absolute stony hardness of the mass, second important thing, that it was declared that there will be no chance of doing surgical intervention. And considering her physical constitution, there was a past history of fibroids removed the hysterectomy was done for fibroids. So tendency towards fibroids, I have started her directly on Conium Maculatum in LM20 repeated doses. I have asked her to take Conium Maculatum 4 times a day. And at the same time, I have started her on Calcarea Fluor 6,6. Both remedies. Calcarea Fluor in biomix, I have repeated. And I have started with the case. Whenever cancer case is there, I used to ask for follow-up after a month. And I have advised all those things which I used to tell all cancer patients about the diet, about the daily routine and daily regimen, all those things. And I have given them a good boost of dose at the with my way of counseling. And they went home. They were from Mumbai. And they visited me exactly after 1 month. And in a quite good mood. So I was happy looking towards her face because she was quite happy. So I saw how's the thing, and she said quite good. Pain has much reduced. So then I have examined her. The tumor was there, but that dead tissue which was looking in this picture, which has much lessened. This is the picture, the second picture. Much change is there, much change. And she was quite happy with that. Even pain was reduced a lot. So I have continued with the Conium LM21, 22 gradually. Within span of 3-4 months, it has reduced to this level in much better condition than the early. So this is a wonderful remedy one can utilize in such types of cancer. Very hard tumors, very big tumors, where the consistency matters a lot. Calcarea Fluor also has that. If it is more ulcerated, we can think of Asteria rubens and hydrastis also. Those are two important remedies in ulcerative stage of cancer, specifically cancer of breast. But here, there was little bit ulceration was there, but it was big tumor, very hard. I have considered Conium, and Conium worked very nicely. So this is what I want to share with you. Let us go ahead with the physicals of this remedy. Page number 107, Conium Maculatum. Glandular indurations of stony hardness. This is the consistency, and which one must highlight this, of mammae and testicles in persons of cancerous tendency after bruises and injuries of the glands. Compare with Asteria rubens. Asteria rubens, that's what I am telling. Asteria rubens, it is the ulcerative stage of cancer that is very marked with the Asteria rubens. It is a far advanced stage of cancer where ulcers are developed. Breasts are sore, hard, and painful before and during menstruation. This is common complaint of the Conium Maculatum, the lac caninum, lac defloratum, Kali carbonicum, lachesis. There are many more remedies where there is a congestion before menses, before and during menstruation. In lachesis, it disappears as soon as menses starts. Vertigo, especially when lying down and turning in bed, and that is the red line symptom of this Conium Maculatum. It is very, very strong. Patient turns in the bed and gets a vertigo. Even Robin Murphy and Nash has mentioned that it is not always the condition that she should lie down and turn. Even she turns in a sitting position, there is a vertigo. Think of Conium Maculatum. That is very typical, and it's really a very important modality. Moving the head slightly or even the eyes must keep head perfectly still. And that's why patient never do this movement and there is a vertigo. Vertigo in turning the head to the left like colocynth. Colocynth also has the similar symptom. When they turn towards the left, they get vertigo. Here it is left or right. Vertigo of old people with vertigo with ovarian and uterine complaints. See, concomitant is very important. Vertigo is there associated with ovarian complaint, uterine complaint. Then you must think about the conium. That is this is the unique combination. Cough. How is the cough of conium? I have used conium in cough of pregnancy. Uh, Second pregnancy her, and she was just 26, 27, and she started getting cough, and which was not settled with usual allopathic treatment. Continuously 1 month she was on many medicines, and it was not getting settled. I utilized Conium because it is a very important remedy in cough during pregnancy. So Conium was given 30 potency, just 3 doses every day for 3 days, and within 4 5 days the complete cough has stopped. It was a very good experience with Conium. Conium cough is spasmodic paroxysms caused by the dry spots in larynx and throat, dry spots in larynx. If it is in throat, it is Actea racimosa. Cough with itching in chest and throat, like iodine. Cough worse at night. Cough worse when lying down. And cough during pregnancy. Very important remedy. Causticum, the calibromium, and this is cough during pregnancy. Great difficulty in voiding urine. Flow intermits, then flow again. Prostatic and uterine affections. So see, prostate enlargement, benign enlargement or cancerous enlargement, a very hard tumor. Think about this Conium maculatum in old person, because it is a very important remedy in benign as well as malignant growths of the prostate. Menses are feeble and suppressed. Too late, scanty, short duration, with rash of small red pimples over the body, which ceases during the flow, like Dalkamar. It is a remedy, psychotic remedy, and that's why you get the oligomenorrhea or delayed menses. These are characteristic of psychotic miasm. Menses stop by taking the cold. Menses by putting the hands, menses stop by taking cold by putting the hands in cold water, like deploratum. So suppressed menses, this is one important remedy. One should not forget. Leucorrhea, 10 days after the menses, very specific duration has been mentioned, like Bovista as well as Borax. Leucorrhea is acrid, leucorrhea is bloody, with bloody milk like, profuse, thick, and intermates. Bad effects of suppressed sexual desire or suppressed menses, non-gratification of sexual instinct, or from excessive indulgence. This is the remedy which has been mentioned under the rubric elements from celibacy. Yesterday I have told about it. There was one case of one sadhvi which I was treating, and she was having a uterine fibroid, and she used to bleed. When it starts, she used to bleed for 10 days, 15 days. It was very hard, big tumor, big fibroid. Even per abdomen, it was palpable. And she was the person, she was around 30, 35 years of age, and she had that fibroid. When I talked with her, when I had discussed many things with her, I took her case, I took it in temple, and she talked a lot about them, and many restrictions have been mentioned for them. If any gents touches their body by any means, they have to punish themselves. Such types of fixed notions, ideas are there. And she said that if you examine me and I touch my body, I have to take punishment. I could not eat for at least for 2 meals. Such type of punishment we have to take. So there are many fixed ideas. And she had a big fibroid. She had big fibroid. She had leukorrhea. She was having leukorrhea for absolutely for longer time of duration. which was offensive. Then she had menses, which there is also menorrhagia because of fibroids. So I have considered one important rubric that as at the age of 35, she was not married, elements from celibacy, and the fibroid uterus. And I have started her with the Conium. And I have continued Conium in LM for nearly about a year. And fibroid started reducing gradually. And it completely resolved within span of 1 year. So this is the power of Conium Maculatum to dissolve the fibroids. One patient, I remember she had multiple fibroids on. At that case, I have shared in Gaurang's platform that many fibroids. At that time, I have used, along with this Conium Maculatum, I have used one more remedy. I think it might be a trillium pendulum and calcarea fluor. So this is a remedy one should not forget in such types of cases. Bad effects of suppressed sexual desire, suppressed menses, non-gratification of sexual instinct or from excessive indulgence, aversion to light without inflammation of eyes, worse from using eyes in artificial light. So artificial light they cannot tolerate. Often the student's remedy for night work, there is intense photophobia like soranum. So they cannot tolerate light, specifically the artificial light they cannot tolerate. The sweating is very characteristic, sweats day and night as soon as one sleeps, and even when closing the eyes. Two important modalities. Whenever they sleep, they get sweats a lot, or whenever they closes the eyes, the sweating is there like syncona. So this remedy has many facets. It has pathology more on female genitalia. It has pathology on the male genitalia. It has pathology on the nervous system. It has pathology in the lungs. So it is a wonderful remedy to be learned and utilized in our practice if we understand this core of the remedy. Relations, patients requiring Conium often improve from wine and stimulants, though persons susceptible to Conium cannot take the alcoholic stimulants when in health. Then he has mentioned about one important thing, that compare arnica and rustox in contusions. This is one more, but here it contusions leads to tumors. Compare arsenic, Asteria rubens in cancer, calcarea and soranum in glandular swellings, but soranum is absolutely chilly remedy. It is followed well by soranum in tumors of mammy with threatening malignancy. So this is, you can follow it with the soranum. A few symptoms which was not there mentioned in the this book, which is the rubric sterility menses suppressed form. Conium is given for 3 marks. It is very important symptom, the rubric which one can think. Then this remedy, the complementary to the Conium is Baratta muraticum. This is very important defecting remedy. Still, sometimes it requires to complement, and Baratta mur is the complement for it. General modalities: aggravation at night by lying down, aggravation by turning or rising up in bed, and aggravation from celibacy. So, see, these facets one must know. This remedy, many cases are there with me, which I have treated, but basically many cases which are related with all those glandular affections, which I have treated with this Conium Maculatum, and vertigos. Vertigo, this is a wonderful remedy. Vertigo, even lying down, vertigo while turning in bed, vertigo when turning the neck. Many modalities are there. So this remedy one should not forget. Read it from Boris Remedica as well as from the other books so that you'll get a whole idea about the Conium Maculatum. So we'll conclude this session with Conium Maculatum and we'll meet on Monday at 8:15 with new remedy. If any query is there, we'll have a chat. Otherwise, we'll conclude. So thank you being there. Meet again on the Monday session at 8:50. Good night.